Hi there, I'm Barbara. I'm a clinical psychologist here at TalkWorks. And today we're going to talk about diagnoses. In the UK, the diagnosis of a mental health difficulty, such as anxiety or depression, can be given by a mental health professional following a formal assessment of the person's difficulties. To diagnose means to label a person's reported difficulties by checking that they fit certain criteria as listed by standard classifications manuals, such as the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. Using diagnostic labels can help professionals provide the best evidence-based treatment for the particular problem the person is experiencing. For example, if an individual is diagnosed with depression based on the DSM-5, then the best evidence-based treatment that can be offered is cognitive behavioral therapy, also called CBT. For any mental health condition, the concept of diagnosis can be controversial. It depends on how the assessment process has been conducted and has to take into account the individual and their personal experiences. As you can imagine, people can experience mental health difficulties in so many different ways. For this reason, a diagnosis of a mental health problem is not definitive in the same way as for physical conditions, such as having high cholesterol. It can vary from person to person and also change over time. And its impact can also change across the lifetime. An important question we can ask is the whole concept of diagnosis helpful to people? A quick answer to this question is, for some people it is, but for others it isn't. A diagnosis can provide a framework for understanding what the person is going through, but that framework may not be helpful for everyone. Some people can respond favorably to a diagnosis, whereas others don't. For example, let's think about a person struggling to get out of bed, not feeling very good or optimistic about the future, feeling terrible about the past. Their eating habits are all over the place, they might eat loads some days, barely anything on others. For this person, if someone were to say, "I think you have depression, let's check it out, let's do a rating scale of depression," these people might start thinking, that makes sense, there is a pathway for improving my symptoms, there is a way out, I'm not alone in this, I have loads in common with other people who have depression, and professionals understand what I'm going through, they can help. For this person, the label is really helpful at that time. For other people, a diagnostic label is not helpful at all. They may feel stigmatized by it. They may not feel empowered to get better or encouraged to do something to take control over their situation. So now we're going to embark upon the next part of our journey, which is understanding mental health conditions more closely. Whilst you do it, keep this in mind. A diagnosis is not foolproof or bulletproof. It can help shorten things and share meanings, but it's certainly not for everyone.